Welcome to the Joint School. This presentation is for patients who are going to have a hip or knee joint replacement and their families. We will cover various aspects of your journey, from what you can do to prepare for your new joint replacement, to what to expect while you are in hospital, and what you can do to help you get home and regain your independence. During this short video, you will hear from some of the members of the team who will be working with you to ensure that you get the best out of your new joint replacement. I am one of the orthopaedic surgeons, and you will also hear from a consultant anaesthetist, a physiotherapist, and an occupational therapist. You will already have met either myself or one of my consultant colleagues, and will have had a discussion about whether a joint replacement is definitely the right choice for you. We work as a team, with you and your family being a major part of that team. Your surgeon will have explained that the purpose of the operation is to help alleviate pain, and hopefully as a result of this, improve your quality of life. Most people are having a joint replacement because the cartilage lining of your own joint has worn away, causing the bone ends to rub together painfully. During the operation, these bone ends are removed and we replace them with metal. In a knee replacement, a plastic liner is used as a cushion between the two metal parts to stop them rubbing together. In a hip replacement, this liner can either be plastic or sometimes ceramic. Your surgeon will have discussed the type of implant that is most suitable for your needs. Whilst most hip and knee joint replacements go smoothly and without complications, there are unfortunately a few patients who will have one of these recognised complications. Your consultant will have explained these complications and discussed them with you, and you should ask them any questions you may have, particularly before completing your consent form. You will usually be admitted to the ward on the day of your operation and will see your surgeon and your anaesthetist before and after your surgery. So please ask us any questions you may have. We really want to ensure you have all the information you require to allow you to mobilise early, regain your independence, and get back home.
Thank you for tuning in to listen. I'm a consultant anaesthetist, and I'm here to share information with you about the anaesthetic care you'll receive for your joint replacement. And I hope that this conversation helps to reduce any worries you may have about your treatment. So, what is an anaesthetist? Well, we are doctors who are responsible for you and look after you during an operation. We are involved in your care from the time you visit the pre-assessment clinic through to your recovery after the operation. And we'll meet with you to talk about your anaesthetic, either at the pre-assessment clinic or on the ward on the day of your surgery. And during this conversation, we want to find out about your preferences, about the type of anaesthetic care you receive, and give you an opportunity to share with us any worries you may have, because it is important we know what matters to you so that we can provide you with care tailored to your needs. We'll also ask questions about your health, and we'll discuss the options available for your anaesthetic, the benefits, the risks, and the side effects. And finally, we will explain the plan for pain control after your operation. And I want to encourage you to write down any questions or concerns that you may have between now and then, so that it is easier for you to discuss these with us when you meet us. Two types of anaesthetic can be used for joint replacement operations, either a spinal anaesthetic or a general anaesthetic. Both techniques give good recovery, but one may be better suited to you, and your anaesthetist will discuss that with you. A spinal anaesthetic is used in the majority of cases, and I'll take a few minutes to explain what this is. It is an injection of local anaesthetic close to your nerves in your lower back. And it makes you feel numb from the waist down so that you don't feel anything during the operation. And as we don't affect the top half of your body, you can choose to remain awake during the operation. Otherwise, we can give you small amounts of anaesthetic drugs to make you as sleepy as you want, and we call this sedation. If you are awake, you do not see anything as we put up a screen, but you may be aware of background noise. I'm going to briefly explain the procedure. First of all, it's not a sore thing to have done. And we'll do the injection before the operation with you sitting upright and awake. It's a sterile technique, and we wash your back with antiseptic that feels really cold. Then we numb your skin and place a fine needle in the space between the bones in your lower back until the tip of the needle sits in the fluid that surrounds the nerves. Then we'll inject the local anaesthetic into that fluid and take the needle out. Nothing is left in your back. That local anaesthetic medicine bathes the nerves and it seeps into the nerves, makes them numb within 5 minutes. Now, as your nerves begin to get numb, your feet and your legs will feel very warm and tingly, but this is normal. Before we let the operation start, we check that the spinal anaesthetic is working. And then we give you sedation if that is what you wanted. We will be by your side throughout the operation. And that numb feeling from the spinal anaesthetic will last up to 3 hours and then slowly wear off. It will take up to 6 hours for your feeling to come back completely. So, what are the benefits of a spinal anaesthetic? You're able to eat and drink immediately after your operation. And compared to a general anaesthetic, there is a lower risk of developing breathing problems, of feeling sick and vomiting, and of experiencing confusion. But as with any treatment, there are complications that we need to discuss, and these are all detailed in the leaflet you receive. With spinal anaesthetics, it is common to have low blood pressure after your injection. But we monitor this closely and will give you treatment if it happens. Less common problems include failure of the spinal anaesthetic. So either we're unable to get the injection in the correct place, or your legs are not numb enough. And if this happens, we would use a general anaesthetic instead. Another uncommon problem is urinary retention. Basically, this is where you struggle to have a pee once your feeling has returned to normal. Now, the staff will monitor this on the ward, and if required, place a catheter into your bladder overnight to stop your bladder from getting distended or too big. Finally, damage to nerves is a very rare complication that we always tell people about. If this occurs, it is usually temporary, lasting days to a few months. The other option is a general anaesthetic. Now, this is used if a spinal anaesthetic is not possible or if it's what you prefer. You're given anaesthetic drugs to make you unconscious so that you don't feel anything and you're not aware of anything during the operation. Whilst you are unconscious, we put a breathing tube into your throat and windpipe to control your breathing. And when the operation finishes, we turn off the drugs that have been keeping you asleep and you wake up. Again, we are by your side throughout this time. Common complications from a general anaesthetic include having a sore throat that lasts a day or two, feeling nauseous and vomiting, and some people are drowsy after they wake up. Less commonly, you can have damage to your teeth and also struggle to pass urine, as I mentioned earlier, urinary retention. Rare complications include heart and lung problems. Finally, drug reactions can occur with both types of anaesthetic, but we use more drugs with a general anaesthetic. Those of you having a knee replacement may also have a nerve block called an adductor canal block. Now, this helps with pain relief for the first 12 hours after your operation. And we use an ultrasound to guide a needle so we can inject local anaesthetic near to your nerves as they travel down your thigh towards your knee. It will work alongside your spinal anaesthetic or your general anaesthetic, and it is done after you've had them, so you don't feel anything. At the end of your operation, we aim to have you awake and alert, and we'll move you to the theatre recovery. There, we'll look after you and monitor you for 30 minutes until you're ready to return to the ward. We will, at this point, encourage you to move your legs as soon as you feel able. And we'll try and have you as comfortable as possible after your surgery, but it will still hurt. Sorry. Many of you will already be taking painkillers and are living with pain. So, during your hospital stay, we will increase and adjust your painkillers after your operation with the aim of having you comfortable enough to move and to sleep. You will get regular painkillers, with extra available if required at other times. Now, it's normal to feel pain or discomfort, but please don't let it build up too much. If your new joint hurts too much to do your exercises or to sleep, then speak with the nursing staff to request more painkillers. Because it is vital to get these new joints moving early on in your recovery to make them successful in the long term. There are important things you can do that will make a difference to your recovery after surgery. What I mean is, it'll increase the odds of having a good recovery. And quite predictably, the most important thing that you can do is to stop smoking if you smoke. Even stopping for just 4 weeks before surgery makes a difference. Please try and limit your alcohol intake to the recommended 14 units per week, because too much alcohol weakens your immune system. And finally, easier said than done, but please keep moving whilst you're waiting for your operation so that you're as fit as possible. Now, if you want to know more about how you can get fitter for surgery, there is a good 9-minute video called Prepare for Surgery, Fitter, Better, Sooner, and that is made by the Royal College of Anaesthetists. The link to this video is in the YouTube notes for this presentation.
You have committed to major surgery to make your life better. Once your surgeon has done their bit, it's down to you to get that joint moving and the muscles around it strong. Physiotherapy's role is to guide you on what you need to do, but you need to commit to carrying out your exercises regularly to make the operation a success. Once your sensation and movement have returned and you're feeling well, you'll be assisted to stand, walk, or get up to sit in the chair that same afternoon. You'll need assistance to walk at first, and will most likely start off with a walking frame to begin with. If your operation is later in the afternoon, it may just be up to the commode or toilet with the nursing staff later that same evening. As soon as your movement has returned into your legs,
you can start gentle exercises. Wiggle your toes, bend your ankles to move your feet up and down. Tense your thigh muscles, pushing the backs of your knees into the bed, pushing the legs straight, and squeeze your bottom muscles, clenching your buttocks. Small movements like these help your recovery, so don't wait for someone to tell you to start. After surgery, it's normal to feel some pain, feel tired or nauseous. You'll have less control of your leg initially and have swelling and bruising that can be the whole length of your leg down to your foot. Despite this, we'll still encourage you to mobilise. Why mobilise early? It's what's best for you. Getting up and out of your bed early after surgery helps to improve your circulation, so it lessens the risk of blood clots. It's better for your breathing. It's better for your pressure areas, your skin. It aids digestion, so you're less likely to get constipated. And it helps you pass urine, so you're less likely to need a catheter. Ultimately, getting up early means you're less likely to get complications from having had major surgery. Often, although fearful of getting up, people feel more comfortable for doing so. By moving the joints and getting the muscles working, you help to disperse some of the bruising, some of the swelling, which in turn often helps with the pain. This then allows you to move more. What we don't want is you staying too still and seizing up. However, having said this, you can overdo it. Listen to your body and gently push yourself, little and often. Don't do circuits and circuits of the ward unless you're feeling well doing so. A good tip is to change your position throughout the day between the chair and resting up on the bed. This regular change of position reduces stiffness, helps with comfort, and it also is good for any swelling in the lower leg. There's things we like you to achieve before getting home. A natural walking pattern with sticks or crutches. Although you may likely start off with a frame, unless you walked in with one, you'll not go home with one. You must be able to get on and off the bed, chair and toilet, and be able to get washed and dressed. We like to see you go up and down the stairs safely. Even if you don't have stairs at home, you'll be out and about and you'll come across curbs and steps, so we like you to be able to do stairs. You must be confident with your exercises and know how to strengthen yourself further at home. We'll not send you home until you have achieved these goals. How long this takes varies from patient to patient, but some go home as soon as the day after surgery, some the second day, some the third. It's becoming more common for certain patients to go home the same day of surgery. But if this was thought appropriate, we'd discuss it with you prior to coming in. As hip and knee joints differ in their shape, they also differ in their rehab. With hip replacements, a good walking pattern is important to strengthen and get the joints moving. Whereas with knee replacements, walking alone will not get you the movement or the strength that you need. Walking too much on a knee without the strength and stability will cause it to swell up and give you pain. In the case of knee replacements, you will have to work hard to get that knee straight and then be able to lift it up as a straight leg and also to be able to bend it to at least right angles. In the YouTube video notes for this video, you'll find links to other videos which show our physiotherapists demonstrating these exercises that will be provided to you after your operation. Start these now to become familiar with them.
Those who are undergoing a total hip joint replacement will receive an occupational therapy assessment following your operation. The occupational therapist will assess your ability to get washed and dressed, get on and off a chair, bed and toilet, and discuss bathing and kitchen tasks. Recommendations will be made accordingly, including the provision of any necessary equipment. We recommend that you listen to your hip and avoid extremes of movement. These pictures show you some examples, but it will be discussed further with you whilst in the hospital. This is a useful video which gives you guidance on how to get in and out of a car after your surgery. Now that we have covered what to expect, here are a few useful points to consider in preparation for coming into hospital. When you come into hospital, expect to get dressed from the first day after your operation. Bring loose, comfortable clothes, enough for a short stay only as storage space is limited. Bring in shoes and slippers that are well fitting and easy to put on. No backless slippers, flip-flops or mules. Please bring all your medication in their original packets, including inhalers and sprays you have not used for some time. It can be nice to bring in a book, laptop or tablet to keep you occupied. Think of how you will update your family of your progress. Often it can be useful to bring in a mobile phone so that friends and family can contact you directly. If relatives do require to contact the ward, then please nominate one person to do so. Start planning who can take you to and from hospital, as most joint replacement patients do not meet the criteria for patient transport. Any issues, please let the nursing staff know. You can also prepare your home environment before coming in for surgery. In the kitchen, ensure everyday utensils are accessible and do not require you to overreach or crouch low. Prepare quick and easy food which can be stored in the freezer in advance. Remove any rugs and non-slip shower mats. It may also be useful to arrange initial support with housework and shopping. It is not easy getting a joint replacement. It is major surgery and you will be sore. It requires commitment and motivation to get the best outcome. However, the whole team are here to advise you and keep you right. If you work hard at your exercises, you will get the results. Now click on the link and start practicing your exercises. Thank you for listening and we look forward to seeing you soon.